Hi everyone, this is Dr. Lin of Rehab and Revive Physical Therapy. I wanted to teach you guys a great little stretch for, actually it's great for people with lower back pain, and Stephanie herself has run into a little bit of trouble, so I wanted to use her as our little case study today and offer you a modified Thomas stretch is what it's called out there. I teach it a little differently. Some people teach it all different ways, but I kind of like it this way. I think it's safer. So let's have Stephanie over here. Why don't you have a seat right here at the very edge. Make sure you have a secure surface. You can try at the edge of your bed. Sometimes your bed's too soft. I actually tell patients to kind of stagger themselves. We'll show you that modified one for you out there. But what I want you to do, Stephanie, I want you to hug both knees to your chest. Hug both knees. And you're gonna scoot to the very edge a little more. You wanna be almost off. Yep, hug, and then I'm gonna have you rock onto your back right here. Perfect. What you're gonna do here, and we're gonna use this leg here, is this actually accomplishes a few things. It accomplishes the ability to see A, if the hip flexor is really tight, B, the rectus femoris, the quads are tight. I'm gonna let this relax. Or if the IT band or TFL, that's what they say, the tensor fasciae latae is really tight. Well, right now this isn't bad. I'd prefer this though, is to have this touching the table naturally. So what you should do, like I said before, hug both knees, drop down. That way you protect your lower back instead of just hinging on your lower back and then creating this. So how could she make this better for herself? You're gonna hold this tight right here. Okay, Seth? You're gonna cock your foot up a little bit, and what you're gonna do is very slowly pretend you're trying to press your heel down to the floor, and you're gonna do active stretching. That's like my favorite thing. You've done active plunging, you've done active, foam rolling. This is a little bit of an active stretch. So she's just gently gonna go there, and it's a little bit of pressure. You don't wanna force this. Make sure this is the right exercise for you. If you do this wrong, you can impinge your femoral nerve, and we don't want that to happen. So make sure you check with your healthcare professional, but you wanna feel a little bit of pressure here. The reason you gotta impinge your femoral nerve is because your femoral nerve runs through here, and your bones can win. Your bone's gonna pinch that poor guy. So just listen to your body, don't go past your barrier, and then you can relax a little bit, and you try it again. So pressure on, pressure off. Great. And then you would do the same thing to the other side. So, yep, this is doing great. And she's starting to get closer to the table, right? And she's already starting to get closer to the table. And I kind of just took myself here for now, just to help her, but this is what she's gotta do at home. Now, when you go reverse, you hug both knees back to your chest, and then you hold this tight, then drop this side. Let's see what happens on this side. A little bit tighter on this side. Is that relaxed? Dang! You can see that this angle. So that's her quads. Her quads are super tight. And so she can actually actively do some knee bends. So go ahead and do that to get a little bit of stretch. So this is actually a perfect example. One issue was more of her hip flexor. This one's more here. And if it was the IT band, you can actively just have her go towards the top. If you look down, she's going more adduction. That's great. Good. Now, if you want to modify it a little bit because you have a soft mattress, what I'm gonna have you do here is go ahead, hug both knees up here. You can kind of, tilt yourself a little bit. So we're gonna move over here, Steph. Just go ahead. Right over here. I'm just gonna move your head up here. Just kind of, yeah. You just can hold that, and you can drop this off to the side. And sometimes that gives you more surface area for the mat, and you can do that active stretching again. So how does that feel, Steph? Good. It's great little stretch. One of my favorites. I did this in track over at Boston University, and it saved me from a lot of back pain all the time. But this is how I like to do it. So there you go, and then you can rock yourself up, or you can just roll to the side, whatever you prefer, and that's what that looks like. I'm Dr. Lin. This is Stephanie of Rehab and Revive Physical Therapy. Thanks again for tuning in. If you like what we're doing, please subscribe below and share this video with all your buddies, and leave any comments, or you can email us any ideas or tips or feedback to rehabandrevivemedia@gmail.com. All right, remember, we can and we will get better together. What we're gonna do is, what you want to do is hug both knees. That's one. Then you're gonna make sure you're at the edge or off, like tilted off the side of the table. You're gonna roll on your back. You're gonna hug one of the knees, and then you're gonna let it drop. Now you gotta find out which one needs to, if your legs are flared out, you wanna move it in. If your legs are if your knee is extended, you wanna bend your knee. If your hip is extended or flexed, you wanna push it down. So those are the keys to success for this exercise. Great exercise once again.